December is the time for glitz. Never stop until each lamp on your Christmas tree is sparkle, jolly, twinkle, jingly. And every ornament that's sitting, waiting on a shelf. Busy decorating, why not decorate yourself? Soon bring a smile to every person you see. Sparkle, twinkle, jolly, what? Close enough. And if you're at a loss, remember the phrase that says to thine own elf be true, to thine own elf be true. When it comes to Christmas displays, look inside and you'll know what to do, you'll know just what to do. Merry folder all on every wall and every nook. Tinsel up each corner till it's Christmas everywhere you look. In the world a holiday that's bright as can be. Make it sparkle, jolly, twinkle, jingly. Hey, Lexi. It's a cheery folderol on every wall and every nook. Tinsel up each corner till it's Christmas everywhere you look. Give the world a holiday that's bright as can be. Make it sparkle, jolly, twinkle, jingle, shiny, showy, cheery, cring, razzle, dazzle, ring-a-lingle.
I can't lie, it makes me tingle.
Sparkle, jolly, twinkle, jingle. Yeah, that's how we do it. There's a saying we have up north that helps put our best foot forth. If you want to deck the halls for Mr. C, make sure there's sparkle, jolly. Oh my God. Usual home office bull, Dickie. The room is gloomy and its atmosphere is called it quits. December is a time for glitz. Up until each lamp on your Christmas tree is sparkle, jolly, twinkle, jingly. Every ornament that's sitting, waiting on a shelf. While you're busy decorating, why not decorate yourself? Smiling every person you see. I'm sparkle, twinkle, jolly. What? At a loss, remember the phrase that says to thine own elf be true, to thine own elf be true. When it comes to Christmas displays, look inside and you'll know what to do, you'll know just what to do. Bring every ornament that's sitting, waiting on a shelf. Oh my God, I can't. Holiday that's bright as can be. Make it sparkle, jolly, twinkle, jingly.
Did you hear about Wonder Man?
It's a big show.
That's what I've been trying to tell you. What if they find out about my secret?
Morgs, get off my channel.
I don't know. I know what I don't want for Christmas. I
Don't want a check that's made out to cash or a corporate re-gift from some secret stash.
I'd like a day with my dad.
Just a day, make that two.
If you can
Do that, Santa. I'll believe in you.
don't want a trip to some
Hip salon,
trendy perfume I'll never put on. I'd like to feel like he cares, even if it's not true. If you can do that.
ever since you heard from me. I thought it was worth a shot. If it's true that you're magic, I guarantee use all the magic you got. I guess that's our list. Our letter is done.
Is it
Really a list. It adds up to one.
making part of our lives?
It's not just passing through. You can do that, Santa. I'll believe in you. You do that, Santa.
I'll believe in you. So
Good luck, Santa. Here's hoping you come through. Sign Emily. And Michael too. Yes.
I told you, I don't sing. For anyone at any time, including birthdays, bar mitzvahs, and especially Christmas. Come on, Jovi, singing can be
Be easy. Please stop.
It's fun, it's free, and
And best of all, it's totally
Totally
cheesy.
cheesy? all
All you have to do is move your voice much higher. High, low, high, low.
It's just like talking, only it's sustained and make it sound pretty. No.
Just sing a Christmas song. It's like magic if things go wrong. Just spread some Christmas cheer by singing out for all to hear.
People are staring.
That's the point! Just sing a Christmas song. Keep on singing all season long. Think of the joy you'll bring if you just close your eyes and sing. And if you're short on cheer, think about that year you woke up to find a brand new snow had fallen. The ornaments you made way back in second grade, untangling the Christmas lights, took your father several nights. Mother claimed that she had proof there were reindeer on the roof. Remember who you were back then, and those moments live again. Come on, Jovi, try for me. Just sing a Christmas song. That's it. It's like magic if things go wrong. Keep going.
Just
Spread some Christmas cheer by singing for all to just sing a Christmas song and keep on singing all season long. Think of the joy you'll bring. Just close your eyes. Close your eyes. Just close your eyes and Mom. 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 Mom.
what?
I saw a tiny sleigh make its tiny way right across the sky. There wasn't time to think, there wasn't time to blink before it zoomed right by. And everything I knew, and everything that you knew too is absolutely now untrue because without a doubt there is a Santa Claus.
Oh my god.
I just saw him too, yet my whole life through he seemed fake to me. Couldn't stand to see what a fantasy he appears to be.
And everything I thought is
Tangled up in one big knot, the world out there has clearly got its flaws. They can't say there is a Santa Claus. It's hard to be sedate or keep your head on straight when fairy tales come true. No, I can't complain, cause if I'm insane, that means you are too. So why don't we make a pact? Soul and flesh should be exact, the soul is really fact he always was. No, I've had my doubts before, but now there's proof I can't ignore. Why deny it anymore? There is yeah, that's how we do it. I saw a tiny sleigh make its tiny way right across our sky. There wasn't time to blink, there wasn't time to think before it zoomed right by. And everything I knew, and everything that you knew too is absolutely now untrue because without a doubt there is a Santa Claus. I just saw him too, yet my whole life through he seemed fake to me. Couldn't stand to see what a fantasy he appeared to be. I thought I singled up in one big knot, the world out there clearly got its flaws. They can't say there is a It's hard to be sedate or keep your head on straight when fairy tales come true. Though I can't complain, cause if I'm insane, that means you are too. So why don't we make a pact? The soul and flesh should be exact, that Santa's real, in fact he always was. I know I've had my doubts before, and now there's proof that I can't ignore. So why deny it anymore? There is yeah! I can't. Oh my god, I can't. Oh my god, I can't. Oh my god, I can't. Ugh. Oh my god. Yep, I don't believe you. Fix that shit. Also, deep breath, you and me, and nose, out the mouth, right now. Stellar. You are that bitch? Go get your day and fuck it up!
Thank God for Friday, I think I might have died. If I spent another day working for the suit and tie, we put a 40 in and they
Finally let us free. Then to the pump where everybody sings. Hey, just get us on cold. Raise it up tonight until tonight's tomorrow. Going for every second week. Tonight all I need is a get me drunk drink. Hey, never wanna be. Tonight all I need is a get me drunk drink. Oh God.
This is how you distribute your podcast to Apple Podcasts, Spotify, and all of the other podcast players. First, you need two things: at least one episode and a podcast cover art. I recorded my podcast trailer.
You're out of the woods, you're out of the dark, you're out of the night. Step into the sun, step into the light. Keep straight ahead for the most glorious place on the
Face of the earth or the sky.
Hold on to your breath, hold on to your heart, hold on to your hope. March up to the gate and bid it open. Open! There's a garden spot I'm told where it's never too hot and it's never too cold.
Where you're never too young and you're never too old. Where you're never too thin or tall. You're never too anything at all. It's all true. Oh, we're not too mad and we're not too sane. And we don't compare and we don't complain. All we do is
Just sit tight.
cause it's all so downright.
Right. Oh God. Ha ha ha! Ho ho ho! And a couple of tra-la-las. That's how we laugh the day away in the merry old land of Oz. Buzz, 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 chirp, 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 and a couple of la-di-das. That's how the crickets crick all day in the merry old land of Oz. Get up at 12 and start to work at 1. Taking out for lunch and then at 2 we're done. Jolly good fun! Ha ha ha! Ho ho ho! And a couple of tra-la-las. That's how we drift the day away in the merry old land of Oz. Buzz, ha ha! Ho ho ho! Couple of tra-la-las. That's how we laugh the day away in the ha 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 ha! Merry old land of Oz.
Oh, it's everything you said it was and more.
When do we get to see the wizard? Will you take us to him? Is he scary? The wizard? Why, yes,
Of course!
But first I'll take you
And
to a
then
place where you can tidy up a little.
Here we rush with
Soap and brush to make you clean and fair. Pat pat here, pat pat there, and a couple of brand new straws.
That's how we keep you young and fair.
The merry old land of Oz. Here we go. And rub here, rub down, whether you're tin or brass. That's how we keep you in repair in the merry old land of Oz.
We can make a
Santa Claus. Let's move! Ha ha ha! Ho ho ho! Ho 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 ho! Starting off the day away in the merry land of Oz. Get up at 12 and start to work at 1. Taking out for lunch and then at 2 we're done. Jolly good fun! Ha ha ha! Ho ho ho! Ho 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 ho! Starting off the day away in the merry old land of Oz. Starting off the day away when ha 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 ha. Merry old land, merry old land, merry old, merry old, merry old land of Oz. And I win. Thank God. Whew. It's another one done. I don't know, babe. I don't know. You got my number too, so.
Hi, I'm Glinda, the Witch of the North.
Who's that?
The Munchkins. They're happy because you freed them from the Wicked Witch of the East. It's all right. You may all come out and thank her. Come out, wherever you are, and meet the young lady who fell from a star. She fell from the sky, she fell very far, and Kansas, she says, is the name of the star. Kansas, she says, is the name of the star. She brings you good news, or haven't you heard? When she fell out of Kansas, a miracle occurred.
It really was no miracle. What happened was just this. The wind began
began to switch
the house
to pitch.
and
Suddenly the hinges started to unhitch. Then the witch, to satisfy an itch, laying on her broomstick, aiming for a hitch. Oh, what happened was the witch. The house began to pitch. The kitchen took a switch. It landed on the wicked witch in the middle of a ditch. Now a healthy situation for the wicked witch. Began to pitch. The kitchen took a switch. Landed on the wicked witch in the middle of a ditch. A healthy situation for a wicked witch. Began to twitch and was used to sing. Wicked witch.
We thank you very sweetly for doing it so neatly.
You've killed her so completely that we thank you very sweetly.
Let the joyous news be spread. The wicked old witch at last is dead.
Woo! And the witch is dead. Witch, oh witch, the wicked witch. Ding dong, the wicked witch is dead. Wake up, you sleepyhead. Rub your eyes, get out of bed. Wake up, the wicked witch is dead.
She's gone where the goblins go below, below, below your.
No.
Let them know the wicked witch is dead.
Let's go! Let's go!
As mayor of the Munchkin City, in
The
the
country of the land of Oz, I welcome you most legally, and verify it legally to see, if she, or they can't see everything with it. We absolutely undeniably reliably get. Oh, there I most and there I thoroughly examined her. She's not only merely dead, she's really most sincerely dead. Woo!
Friends, this is a day of independence for all the Munchkins and their descendants. If any. Yes, let the joyous news be spread. The wicked old witch at last is dead.
Ding dong, the witch is dead. Witch, oh witch, the wicked witch. Ding dong, the wicked witch is dead. Wake up, you sleepyhead. Rub your eyes, get out of bed. Wake up, the wicked witch is dead. She's gone where the goblins go below, 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 yo ho. Let's open up and sing and ring the bells out. Ding dong, merry ho.
Sing it high,
Sing it low. Let them know the wicked witch is dead.
we represent the Lullaby League, the Lullaby League, the Lullaby League, and in the name of the Lullaby League, we wish to welcome you to Munchkin Land.
Represent the Lollipop Guild, the Lollipop Guild, the Lollipop Guild, in the name of the Lollipop Guild. We wish to welcome you to Munchkin Land. Woo! You to Munchkin Land, la 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 la. La 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 la. You be history. You be history. La 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 la. Okay, so this one's fully charged. What about this one? This one needs to charge. All right, charging that one because it's only on 6.
Ever wonder how some people remember every detail from every meeting? They use Otter AI.
I've shared some pretty wild stories with you guys through the years on this YouTube channel, but I thought we'd watch a very popular show called Untold Stories of the ER. But before we get to it, I have to urge you, click that notification bell and set up all notifications. That way you're sure to get my videos. Let's get started.
These are the real stories of the ER that doctors never talk about.
Already, I'm going to call BS on that one because ER doctors love sharing their stories. This isn't even about ER doctors. Doctors love sharing their stories. And I know many people will jump and say, what about HIPAA? What about patient privacy? If we don't give the patients identifiers, their name, their date of birth, a picture of them, it's totally okay to talk about their case. Otherwise, how in the world would doctors ever learn? We have to talk about cases.
Are you all right?
It's Scott Reed. I'm a paramedic.
So I said, send the ambulance routine. We don't need lights and sirens. We don't need the fire department. Just send an ambulance routine. I think she has fainted on the bathroom floor.
If this ever happens to you, call 911 and tell him to bring everybody. In this situation, it's quite specific because he's a paramedic. He knows what's going on. I prefer that right away you call for help. If a person's unconscious and you aren't sure, start chest compressions. That could be the difference between saving their life and them losing their life just because you were self-conscious or weren't sure if you should do chest compressions. If you aren't sure, the person's unconscious, you've called for help, chest compressions, chest compressions, chest compressions.
We're en route with a 38-year-old female who's had a syncopal episode. She's semi-conscious, blood pressure is 60/40 and dropping.
Okay, so that's the most dangerous part about all of this. The fact that her blood pressure is dropping means that she's not getting enough circulation to her vital organs. Think brain, kidneys, liver. And when that happens, the only option for us in the medical community is to give a ton of fluids to increase the blood pressure into the circulatory system. If that doesn't work, our next resort is to go to artificial pressors, which are basically adrenaline-like medications that cause all your blood vessels to constrict really hard to raise the blood pressure to make sure that the blood reaches everywhere in your body that it's supposed to. If that doesn't happen in time, that could be a cause of death. It's called shock. So basically she's going into shock and we don't know why.
An ECG, a stat, portable chest x-ray, CBC, E7, troponin, a D-dimer, an ABG, the stat bedside cardiology console. I need an echo right away, please.
Okay, so all these tests that he's ordering all make sense. These are all the tests that you'd want to know just to possibly get an idea of what's going on. When a patient comes into the ER, you don't know anything. You don't know if they're anemic. You don't know if they have an infection. You don't know if they have a pneumothorax. Has their lung collapsed? Is she having a heart attack? So you need all of these tests done as quickly as possible so you can slowly start stabilizing the patient and creating a course of action.
She's apneic. We're going to lose her. Bagger.
So when a person loses consciousness like that and they're out of it and you have to breathe for them, right away that's a sign that that patient may need to be intubated. Intubate is when you put a breathing tube down for them. Obviously, the most important part of that is to help them breathe. But the second most important part is to protect their airway. Because if she were to vomit, then that vomit can go right into her lungs and cause even a more serious problem. When a patient is unconscious, they don't have a gag reflex to protect them from inhaling vomit. So that's why we rush right away to intubate. Take care.
Yet for Dr. Christopher Mikos,
this Dr. Mikos needs to tell me what's going on with his scrubs. I like cool scrubs, but I don't know what's happening with those. Maybe this episode is from a really long time ago and those were in then. I think I'm going to have to make him send him a sample of my upcoming scrub line.
His face and whole body was covered in hives, and he was retracting. His muscles were being pulled into his chest. This is a critically sick child, the serious medical condition known as anaphylaxis.
So two things happen during anaphylactic shock that are very dangerous.
Okay, so I'll be right back. I think my, thanks, babe. I'll be right back. I think my dad just got home. Just give me a second. Right, everybody's home, safe and sound. That's what we wanted. Brr.
Dangerous. One is that the oral airway starts swelling. And when that happens, obviously, you can lose your ability to breathe. The second thing that happens is because you have shock, all of your blood vessels dilate, and therefore it drops your blood pressure. This is another form of shock that can be quite deadly because, again, you're not perfusing and getting blood flow to all your vital organs. Anaphylaxis is deadly. That's why we hand out EpiPens to all of our patients who have gone into anaphylaxis or at risk at going into anaphylaxis. That's why when EpiPens are expensive, people can't afford them, I get really mad.
We gave him additional antihistamine. We gave him intravenous steroids.
So antihistamines are great for an allergic reaction, but they don't do anything to treat the symptoms of anaphylactic shock. What you really want to do is make sure that the patient has a secured airway and that they're getting enough blood flow to all their vital organs, which can mean giving them a ton of fluids or pressors.
It was about 3 a.m. on a Saturday night, and the bars have been let out. Most of the trauma that you're going to see has come and gone, and it gets quieter in the ER.
That's actually true. When you're on call, you do have this eerie silence that starts setting in around 3:30, 4 a.m. And that's usually the time where before our morning rounds, if you're on a 24-hour shift, maybe you can sneak in like a 1-hour nap. I will say that after that nap, you tend to feel worse because you wake up and you're just jarred and you want to continue sleeping. So my general advice for medical students, residents, or anyone who's doing those types of shifts, keep it short. Do like a 30-minute nap and then get up and do some work. Because if you start entering the REM cycle and come out too early, that can be really problematic and you'll wake up all groggy.
18 years old, missing left forearm. Didn't do vitals yet.
Okay, Becky, get vitals. Let's get him on the bed. Did any of those cuts, are they on the abdomen? Did any of them go into lungs, into the stomach, anywhere that we need to deal with right now?
The first thing we do in these types of trauma situations is undress the patient as quickly as possible, because it's very easy to miss a wound if you don't have the patient there completely naked. And that sounds like a weird thing to do, but if you step 1 foot into any level 1 trauma center, you will see the first thing doctors do, take scissors and cut off all the clothes. We need to see if they're bleeding from anywhere, because if they have a puncture wound in their abdomen and we miss it and they're pooling blood into their abdomen, they can just go ahead and die right in that moment without us being able to even help them.
Let's open her chest. Want to do that here?
The procedure is called a thoracotomy, and it's almost never performed outside the sterile environment of an operating room.
I've never heard of a thoracotomy be performed in an ER, ever.
Scalpel?
At least try and create a sterile field. Don't just say we're going to open up her chest scalpel. And she doesn't currently have a pulse. I feel like a lot is inaccurate in this representation.
What did he say?
I don't know. You're gonna have to talk to the mother. You speak Greek.
You Greek? You speak Greek?
My wife is fluent in Greek, and she would be happy to help. I'm in a bit of a situation here, and I need your help. Can you help me translate?
So this is kind of messed up because it is a HIPAA violation. It's like a patient privacy issue. But in an emergent situation, perhaps that could be put on hold. What happens in regular hospitals, we have translator phones for this, where one person picks up one phone and the other picks up the other, and through a translator or interpreter, we can actually have a normal conversation. I don't know why he needs to call his wife and get her involved.
Sometimes it's like a needle in a haystack trying to figure out what's causing the allergic reaction.
If a child is having a severe allergic reaction, an anaphylactic shock, it's
Nuts.
not of utmost importance in the ER
Boo,
to figure out
your
what it was
apron.
from. The most important thing is to stabilize the patient using
Nuts,
epinephrine,
nuts,
and if that
nuts.
fails, to put a breathing tube in and then give steroids, high doses of steroids, keep the pressure up through fluids and or pressors, and then later down the line we could start figuring this out. I'm surprised he started doing all of this investigation here.
Lo and behold, I'm like looking at the apron and I'm like thinking food. And not because I was hungry.
Papu, your apron.
Nuts. Whenever a doctor's yelling nuts at you, you're doing something wrong.
Stay away from those nuts. He would have to carry an EpiPen to counteract should he ever come in contact with nuts again.
Please carry your EpiPens and make sure they're not expired. Don't want to be over the Atlantic Ocean having me stab you with a giant EpiPen that's not made to be used as an EpiPen. It's just epinephrine for someone's heart stopping.
Nurse Penny Reed has survived an 8-hour open heart surgery.
Feeling that my mom might not be able to be a normal person again after all of that was scary.
That's the thing, when someone loses their pulse for that long, patients' families have questions for us, like how is this going to affect them? Are they going to be the same? And many times we just don't have an accurate answer. So the most honest thing we can say is we don't know, but we'll hope for the best. Sometimes people don't like that. But unfortunately, medicine is as much an art as it is a science.
When I woke up, they told me I'd had open heart surgery for blood clots, and they told me I'd had a thoracotomy.
You don't always get a lot of victories. So it was the best moment of my career so far.
That's one of the great things of being an ER doctor. When you intervene in a patient's case, you get the result and that gratification right away. As a family medicine doctor, a lot of times I'll give a treatment or a plan that will take months or years to even come to fruition. When we're talking about weight loss, reducing cancer risk, it's not as instant.
Oh my god.
You need to create
He's
more
so
video content.
badass and
We
I
don't have
love
enough
it. Oh
hours in
my
the day.
god.
With Animoto, you can create
So bad.
There's Chicago PD. There's Chicago Fire. But I'm most concerned with, you guessed it, Chicago Med. Let's get started.
Ooh.
Doesn't look too bad, all right? You're gonna be all right.
Good triage.
45-year-old male, left leg amputation.
Treatment 2, Mortimer, GCS3, BP of 90 by PAL.
GCS3 is the Glasgow Coma Scale. 3 is very bad. You need to be intubated. You're basically in a life or death situation at that moment.
He keeps biting down. I can't get the blade in. Look,
You back in, I'll do CPR.
If you can't insert a tube to help someone breathe, one thing you can do is you can continue bagging them. That still oxygenates their airway. It's obviously not as ideal as putting an endotracheal tube in, but the most important thing is CPR, chest compressions, chest compressions, chest compressions.
Almost there. It's not time yet.
Never ideal to do chest compressions with one arm like that. But I can understand if he's been doing chest compressions for 15 minutes. It's really tough. It's tiring to do chest compressions. I've done chest compressions for a while, and generally after each round, you have a student or a resident standing behind you ready to jump in and start doing the chest compressions. Because it's all about at least getting 2 inches of compression to the chest, which can sometimes break ribs, but it's all about getting them enough time to get to the hospital to hopefully save their life.
I got it from here, man.
Nope, he's mine.
Okay, who the hell is this
guy?
Says
He's
he's
a
a
doc.
Get off the gurney, Doc. I'm senior resident in the CR.
Yeah, well, I'm your new trauma fellow.
Doesn't happen like that. Trauma fellows don't just run in. This guy could be anybody. You need to see some ID. I'm all for the show, trying to set up the stage for this character. But people don't just run into the hospital and say, I'm the doctor now.
Get a BP and keep giving him blood. Send a rainbow of tubes and a type and cross. Get his blood gas and get him to the OR.
Type and cross, again, you're trying to find out the correct blood type. For now, giving O negative is fine, but you don't want to keep wasting the O negative blood, so you want to do a type and cross. When he says the rainbow of tubes, that's basically tubes that are sent off for a wide array of tests like CBC, which is a complete blood count, BNP or CMP, which is a metabolic panel, a PT-INR, which shows clotting abilities and clotting times.
No gag reflex, didn't even need sedation. Not good.
Got another problem.
We got another problem.
This woman's pregnant.
This woman's pregnant.
Oh, God.
What he's doing there with the ultrasound is called a fast scan. It basically allows you to see if there's any internal bleeding going on, especially in the abdomen, because you can lose a lot of blood in the abdomen without even knowing that you're bleeding into the abdomen. But obviously, in this situation, he's found that this patient is pregnant, which complicates the situation even more.
20-year-old male, cystic fibrosis, complaining of
chills, labor breathing, times 98.
Jamie?
Maggie?
Hi, Maggie.
Back so soon? I missed you guys.
Cystic fibrosis is a deadly illness, unfortunately, and it basically, you build up so much mucus in your airway because you cannot clear the mucus out of your airways efficiently as someone who's healthy and doesn't have cystic fibrosis. So you get very often lung infections, obstruction in your airway, and most people live somewhere into their 40s or 50s with the illness, and that's pretty much the life expectancy with someone who has cystic fibrosis.
Now, Mr. Dilson, I see that you're using inhaled antibiotics, tobramycin, albuterol. You wear a vibration jacket at night and you use a humidifier?
The vibration jacket actually helps break up some of that mucus and allows it to naturally come out when a patient coughs. Very commonly we use something known as chest physical therapy, which is almost like clapping on the chest to help clear some of the mucus. Parents of young children who have cystic fibrosis are trained in giving their children this procedure.
Baby checks out fine. Healthy heartbeat, amniotic sac, and placenta are intact. Gina, though, I'm afraid, suffered a traumatic head injury, and so far she's unresponsive. We need to contact her family if you have any information.
My husband and I are pretty much her family. She's been living with us since before the embryo was implanted.
That's such a difficult situation. I mean, to have someone be a surrogate to carry your baby and then they're living with you and they're involved in this horrible accident and they have a traumatic brain injury where they're being kept alive by machines. That's going to be a tough decision whether or not to keep her alive using machines so that the baby can continue growing and get to at least to a stage where the baby can survive on its own following a C-section. Man,
Jamie, I've got your test results back.
I wish a little more.
I wish they were a little more encouraging. You're pancytopenic, which means that your cell counts are low. You've got a blood pH of 7.14.
When your blood pH is that low, that means you're trapping carbon dioxide within your body, and you're having obstruction, which comes from the cystic fibrosis. That's very dangerous because when you go into an acidotic state like that, your enzymes within your body can't function, and you can die.
I'd like to intubate you, put you to sleep, get you on a ventilator. You're getting fatigued. This would just allow you to rest so that the antibiotics can do their job.
I've been intubated 8 times. I think I'll skip it.
The purpose of intubating someone who has such a strong acidosis is when you put the tube in, it allows the person to not work to breathe so heavy to expel all that carbon dioxide. The machine basically does it for them. And again, it allows them to rest, it allows the antibiotics to do their job, and it improves the pH quicker than the person can do themselves. Very uncomfortable, not a lot of patients like it. I've never seen, and again, I'm not a trauma surgeon, I'm not an ER doctor, but I haven't seen options given that, frankly, to patients. If a pH was that low in my hospital, generally we would strongly advise the patient to intubate them. But again, I'm not a super specialized in this field, so I'm just going off based off my own experiences.
Sherry?
Sherry?
Dr. Halston?
You need to blow down her CO2, take her off the vet and bag her, give her a dose of Manadol, and increase her dopamine trip to 12.
Right away. Doctor?
Gina's intracranial pressure is rising.
What happens after an injury to the brain is just like any part of the body, there exists inflammation, swelling.
Babe, there's nothing I can do.
And the problem with having swelling inside the cranium is that the cranium's a skull. It's meant to keep things from coming in and protect you, but it also...
I'll be right with you guys. Sorry about that, you guys. Thank you for taking care of that, Dave. Appreciate you.
I got it, babe. No worries. Hey, Valerie. Welcome back, sweetheart.
Hi, Valerie. I'm Ray Backup Channel.
Today's just not my day. Even if I tried, babe, today's just not my day, I don't think.
So yeah, if you're giving me these two Ray's Backup Channel, be sure to hit that subscribe button. Turn on notifications.
Even though this isn't...
Really help her channel a lot.
Even though this isn't on the YouTube app right now, it's on the Prism app because I don't have enough subscribers on my backup channel to go live on YouTube, but I think I do have enough to go live on the Prism app, so I don't know how I'm getting through, but I am, so yeah, welcome back. Because YouTube banned me probably for life, I assume, on my other channel, so as far as I understand it, so...
Unfortunately, her main channel got
Yeah.
for child safety. Like, seriously, YouTube, like, why do you keep banning my girlfriend from the live stream? Like, she didn't do anything wrong. And putting her at risk. So please, stop reporting her channel for child safety.
And now we've lost at least 10 subscribers for my main channel, which sucks, but whatever. It is what it is. I've been dealing with it, so.
Like, it's really getting ridiculous.
I've already lost 10 subscribers from my channel, so. And nobody's subscribed to my backup channel, so. Whatever. It is what it is. Just gonna have to deal with it.
Yeah, babe, can you tell YouTube to stop reporting your channel for child safety? Like, you didn't do anything wrong.
Babe, I've been trying.
On YouTube for reporting your channel, I mean, like, your main channel for child safety.
Babe, I have been. I've been trying to deal with them for weeks. They will not listen to me. They banned my video saying that they did find something, and I didn't even do anything. And I'm guessing this is Greiker's goons' fault. I don't really know who did it. So yeah. I don't know what's going on here.
You need to stop reporting my girlfriend's main YouTube channel for child safety. She didn't do anything wrong. She was just trying to do a live stream, and you guys are banning her for a certain amount of reasons. Like, seriously, stop banning my girlfriend and leave her alone.
I don't know who's at fault. I don't know if it's Greiker's goons, but if it is, I'm not surprised. So yeah.
Yeah, it was Greiker's goons, babe. Like, Greiker's goons need to stop reporting my girlfriend's live stream for child abuse.
And Greiker, I don't know how you got my boyfriend's number, but stop calling him.
It's all for my channel. And Greiker, I don't know why you have my girlfriend's number, but stop calling her, please. Like, we don't need to be bothered by you. Like, seriously, this bullshit has got to stop. Like, seriously.
Like, we didn't do anything to you, Greiker, so get off our channels.
Like, seriously, Greiker, stop calling her. Yeah, seriously, Greiker. Like, we didn't even do anything wrong to you, and you are still reporting my girlfriend. For child safety, so I don't know why you keep doing this bullshit, but it's got to fucking stop. Like, we didn't even do anything wrong. Like, seriously, stop calling our phone number, or we're gonna have to block you. Permanently. Like, seriously, stop calling.
Anyway, let me go back to my music real quick. Babe, I'll see you in a few minutes here. Anyway, let me go back to what we were doing. That way my stream's not as boring. Alright, let me see here. Never thought that it'd be so simple, but I found a way, If you open up your mind, see what's inside, it's gonna take some time to realize. But if you look inside, I'm sure you'll find only a picking you up when you're down. Just turn around. Woo!
Nice.
Yeah! Open up your mind, see what's inside.
It's gonna take some time
To realize, but if you look inside, I'm sure you'll find. Over your shoulder, you know that I told you I'll always be picking you up when you're down. See you guys later on.